Hello everyone, welcome back to our Fire Nursing Tutorial YouTube channel. Today we are going to we are tackling a common yet critical topic, neonatal hypoglycemia. Here, glucose is the brain's primary fuel. If levels drops too low, it can lead to acute symptom and neurological, that is neurodevelopmental issues. And then we will discuss who is most at risk, including babies who are small for gestational age, large for gestational age, or born to mothers with diabetes. In this class, we will cover the signs and symptoms, the proper methods for screening, and the management and treatment strategies needed to ensure these newborns get the best possible start. Let's dive in. Who all have visited first time on this channel, please do subscribe and watch. Neonatal hypoglycemia. We'll see what is neonatal hypoglycemia. Here, neonatal hypoglycemia is low blood sugar in newborn. In neonates, there will be the low blood sugar. Meaning is simple, that is, and then blood sugar level less than 40 mg per dl in first 72 hours. In the sense, first 3 days. In the first 3 days of a newborn or neonate. And then less than 45 mg per dl after 72 hours, after 3 days of a newborn hours, then it considered neonatal hypoglycemia. Next we'll see the causes and risk factors for neonatal hypoglycemia. First one is increased glucose utilization. There will be the glucose utilization is more, that is infants of diabetic mothers, that is hyperinsulinemia, and then large for gestational age babies, and then erythroblastosis fetalis. Here erythroblastosis fetalis, it is a condition where a mother's immune system attacks the red blood cells of her fetus, that is erythroblastosis fetalis. These are the increased glucose utilization. And then next comes to the second cause, that is decreased glycogen or this one fat stores, that is preterm infants, small for gestational age, and then intrauterine growth restriction. And then third cause and risk factor is hormonal or metabolic disorders. Here congenital hyperinsulinism, and then hypopituitarism, and then adrenal insufficiency. These are the causes and risk factors of, that is neonatal hypoglycemia. Next we'll see the clinical features here. First one is a neurogenic, that is jitteriness, tremors, irritability, sweating, and then tachycardia we can observe. And then next one is a neuroglycopenic, lethargy, poor feeding, hypotonia, seizures, apnea, and coma. And then comes to the third clinical feature, that is the non-specific one. Here we can see that cyanosis and then hypothermia. These are the important clinical features of neonatal hypoglycemia. Next we'll see the diagnosis. Bedside glucose test, that is confirmed by lab plasma glucose. And then second is a check serum insulin, cortisol, growth hormone if persistent. Next we'll see that important part of the topic neonatal hypoglycemia is management. We'll see the first one, if symptomatic, if neonatal hypoglycemia is symptomatic or glucose less than 40 mg per dl, that time what have to do? That time give IV bolus of 10% dextrose 2 ml per kg, and then follow with continuous infusion of 6 to 8 mg per kg per minute glucose, and then glucose monitoring should be done every 30 minutes. This is if symptomatic. Next we'll see here, if symptomatic but at risk. Here early and frequent breastfeeding, and then recheck glucose every 2 to 3 hours. And then here infusion rate gradually reduced. Infusion rate has to be reduced if last 2 glucose estimation is more than 45 mg per dl. And then if it is persistent or recurrent, if we observe reoccurrence, that time increase glucose infusion rate, that is up to 12 mg per kg per minute. And then consider hydrocortisone, epinephrine, and then glucagon. This is all about the management. Next, we'll see the prevention. Here, these are the preventing methods. Early feeding, that is soon after the birth of baby, neonate, newborn. Early feeding within 30 to 60 minutes of birth. And then monitor blood glucose in at-risk neonates. And then maintain warm and avoid hypothermia. These are the preventing methods. I hope you all are clear with the topic neonatal hypoglycemia. Please like, share and subscribe to my YouTube channel for more informative topics. Thank you for watching.